everyone. My name is Dr. Ashwin Mehta, and I'm the Medical Director for Integrative Medicine here at the Memorial Health System. And I'm delighted to be part of this wonderful collaboration that we have developed and that we are developing with human resources, organizational development, behavioral health, community and youth services, memorial health and fitness, physician wellness, and so many other committed individuals who are really dedicated to bringing you all the most up-to-date and scientifically sound and accessible resources that you can use in order to address stress, anxiety, and other areas of wellness amid the coronavirus pandemic. Thank you all for tuning in. I'm delighted to be joined today by Dr. Sameet Kumar, who is a clinical psychologist at the Memorial Cancer Institute. We also have Mr. Tim Curtin, who is the Director of Community and Youth Services, and Dr. Tammy Tucker, who oversees behavioral health. So starting with Tim and Tammy, please, would you mind giving us an overview of who you are and all the wonderful work that you do here at Memorial?
Hi, my name is Dr. Tammy Tucker, and I'm the Associate Administrator at Memorial Regional Hospital. And in addition to this, I have the honor and privilege of overseeing the behavioral health product line, which is a very well kept secret. Many employees in the healthcare system aren't aware of the depth and breadth of our services in which we support both pediatrics and adults. And we'll talk more about some of what we have to offer to you as employees and your families and community.
Tim, would you like to say a few words about what you're doing at Memorial?
Sure, thank you, Doctor. I'm Tim Curtin. I'm the Executive Community and Youth Services here at Memorial Healthcare System. And most of the work we do have community-based, and right now we've had some adjustments to make, and we're doing it very, very well. But our programs actually start from prenatal care all the way through adults and just about every single kind of service in between. So we have family services, counseling, and case management, substance abuse and mental health services for adolescents and adults on an outpatient. We work with new moms, moms who may be feeling a little stress after birth, maybe some depression as well. And we also work with families who are raising their grandparents, as well as senior and caregiver programs.
Wow, that is impressive. I had no idea just the incredible breadth of services that you provide. Impressive, and I hope we'll have an opportunity to talk in depth about some of those areas. And Dr. Kumar, you've been quite busy lately as well. Could you give us an update about all the wellness resources that you're making available?
Yeah, I mean, we continue to work with our cancer patients at the Cancer Institute. I think if anything, we've gotten busier, especially with telemedicine and telehealth, being able to reach out and care for our patients in that capacity. We're also trying to, engage with the community electronically and online, and trying to do the best we can. Uncharted territory for all, but I kind of want to make sure our viewers and listeners are aware of just the impact that Tammy and Tim have on our community. I met Tammy 10 years ago, more than 10 years ago, probably 11 years ago, before I started at Memorial, and she was instrumental in rolling out the welcome mat for me and being the first psychologist at the Cancer Center. And I'm just hearing from patients who have interacted with the services that Tim and Tammy, Memorial is a safety net hospital, and I think we're looking at two of the people that make it a safety net for our kids. It's really hard to overstate how important the work that they do has been for not just the pandemic, but really for generations. Multi-generational families that have come across our path and are part of the South Broward community. It's really incredible what they do every day. So I wanted to kind of maybe for our viewers and people who are listening in our community to get a sense of how you've been able to adapt the services you provide to compensate, to adjust uncharted territory we're in terms of telemedicine or any other resources. You're both incredibly creative with what you do. So,
Well, Tammy?
Okay, well, I'll certainly jump in. Starting with our behavioral health services, in terms of the full continuum of care, we have crisis services that start in the emergency department where patients come in. Unfortunately, sometimes they feel so overwhelmed to live for, both for adults and pediatrics, or there's conflicts with families or aggressiveness. Unfortunately, those services are still needed and more than ever, and they're still in place. So our staff have adapted, like other areas of the hospital-based services, with making sure that we keep the patients as well as our staff safe, making sure we're masked. We try to put more distancing in place between patients, between staff and patients, but at the same time providing them with those essential crisis stabilization services that are needed, whether it's just seeing a psychiatrist or a psychiatric nurse practitioner in the emergency department, and maybe getting a medication adjustment or getting some resources to go back into the community, or unfortunately in some instances we may end up needing to hospitalize that individual to get them stable so that they can go back in the community. Our outpatient services had to make the biggest adjustment. We had a lot of services in outpatient behavioral health, which is located on 29th Avenue in Hollywood, a rather extensive group of programs. We did a lot of group therapy. We worked as part of our substance use disorder programming. We worked a lot with people that have opioid disorders and are at great risk of overdose and death in their medications, as well as we have a very robust drop-in center where people after could come 7 days a week, 365 days a year. Well, as part of the pandemic, we had to stop doing a lot of our group services. We closed the Rebels Drop-In Center and immediately jumped into action and started reaching out to patients and consumers by using telephone or using telehealth services. Bill Manzi and his team were critical in coming in and helping get our therapists set up so they could do telehealth services and stay in touch with our patients. We figured out how to start running groups. That was quite an adaptation of doing services like using things like Zoom or Microsoft Office, web-based services that we could do group therapies. We continued with our most vulnerable population to do groups, but we made the groups much, much smaller so that we could have social distancing, masking, extra cleaning, and in between, because those patients were very, very vulnerable in early recovery, and they really appreciated what we did and have told us over and over that we were a lifeline. And it was also during that time other providers was down. So we saw a big increase in some of our people seeking out substance use services, and we had to kind of keep people afloat while their regular practice physicians that were supporting them closed their offices.
Incredible.
Tim?
Incredible.
Sure. Yes, and you know, it was Friday, March 13th, so Friday the 13th, and schools were officially closed. At that day was announced that schools were going to be closed, and at that point we knew that we were going to go remote. We had a big staff meeting. We have 115 full-time employees, and by the time the day ended on Friday the 13th of March, each one of them left the office with a laptop, a cell phone, and they actually took their desk home with them. A lot of younger staff in our department, millennials, if you will, and they jumped right on that. It was a smooth transition. They were very comfortable in that space, in that environment, working remotely, working electronically. Started up groups immediately, and all the youth that they were serving, of course, are on WhatsApp and this time. So it started like that. Then we went more formal to Zoom, and we used as well and Microsoft Teams. We've been doing virtually everything remotely in terms of our clinical work. So our family counseling, our individual and group counseling. We provided mother-baby, and if I could share some pictures with you, I will, in terms of, you know, pregnant moms and making sure, you know, the baby feels fine and all kinds of work that normally is done face-to-face. We were doing as best we can online. Clients were very, very receptive to this and continue to be receptive. And as Tammy alluded to, we're easier and busier than under our normal circumstances. People were scared. People wanted answers. We were providing a lot of health education and continue to do so throughout this event. Our partners and our organizations that we work very closely with over the last 20, 21 years They really stepped up. Memorial sends all of our computers, when they come off the line, we send them to a nonprofit who cleans them, all the medical information off, and loads Windows 10 and firewalls and storage. We ended up getting about 35 laptops into the hands of students who didn't get them from their schools so they could keep up educationally over the last 3 months. We have a great food bank partner that used to actually work here at Memorial. She's in her own food bank now for about 20 years. We've collaborated with her. We pick up about 1.5 tons of food every week, and we deliver it to those who are homebound, whether they're seniors or new moms. And we call those front. So we're not going in the home, but they're property visits. We're connecting with people at 6 feet, diapers, whatever supplies, whatever those needs are for those families that we could possibly fulfill. Our team is out there doing that. We've been working a lot with families, and a lot of the stress that's coming from, really a lot of it is the educational stress. Once that started and parents had to become teachers, that was pretty tricky. So a lot of the case management and the work we've been doing with our therapists have been educational as well as so the work goes on, and I think the most impressive has been our seniors. Our seniors, many of them have smartphones, but typically just use the phone access. Many of them don't really worry about all the other tools. And around the holidays, we have high schoolers that come in, and part of their community service to our senior centers, they teach seniors how to use some of the other features in their smartphone, such as texting. So lo and behold, this event literally seems like it happens overnight, and our seniors are totally isolated, and we fear that the most because we are in our programs to avoid and prevent isolation. So here we have all of our seniors locked in. They're scared. They're the highest risk group. They're reading about nursing homes, and we are totally connected. Smartphone, emotionally, socially. The only way we're not connected right now is physically. And the seniors didn't want to change any of the schedule that we have in our senior centers. So we have sing-alongs every Monday morning. We have a virtual bingo platform on Friday afternoons. We have spiritual groups in English and Spanish weekly. We're doing a lot. We have joke hour. They tell each other jokes. But whatever keeps the seniors connected with each other, because this is an issue that they really hits home with them more than other maybe subgroups. And again, they are fearful. We dropped off masks. We got them gloves, whatever we can get our hands on early on during this episode. So I'm really proud of the seniors and the work that our entire team is doing. And a couple of weeks ago, I said, I will never tell another millennial joke again, because they really rose to the occasion during this event and really helped us along here.
My goodness, thank you. I'm just incredibly inspired by your stories. Everything from front porch support to telehealth, and everything that you've done to create a real sense of community, especially for those individuals who are at highest risk for feeling alone, feeling isolated. Really, thank you for all the wonderful work that you're doing. I'm honored by your stories. Tammy, one other question for you, and Tim, please feel free to chime in as well. A lot of our work has been designed to provide wellness and resilience resources to our employees, within the Memorial community, and oftentimes, especially when it comes to caregivers and providers, there's this sense of we have to just grin and bear it and keep giving of ourselves. And kind of, at the expense of oftentimes our own physical and mental health. And one of the barriers to seeking out help is oftentimes, a concern about confidentiality. Could you talk a little bit about the resources that are available for our Memorial community, and what methods are in place, what practices are in place to create that safe harbor where people can seek the care and the help that they need?
Sure, Dr. Mehta. Certainly confidentiality and respect and privacy is first and foremost in any kind of work that we do in behavioral health. So all of our staff are very sensitive and honored to be a real family, just like behavioral health staff get treated by our nurses and physicians for health, obviously. So we take confidentiality and privacy very, very seriously. We have many, many processes in place to maintain that privacy and security. Many people might be familiar with the break the glass and not being able to access behavioral health charts without going through extra steps. And so people are concerned about that. We are happy to work with people to provide them referrals and resources outside of the behavioral health care system if there's a particularly sensitive issue. And we totally honor and respect that. In terms of services that are available to our staff, in the height when we were system and getting admissions of patients that were positive with COVID-19 and many throughout our hospitals, our administrators reached out to our outpatient behavioral health staff, did a program called Heroes Helping Heroes, and actually went into the hospitals and provided support services, COVID floors, so they had an out, they could talk about the things that they were seeing and not accustomed to. For example, so many people going on ventilators, losing, Memorial, we're very proud. We have a very low mortality rate as a general rule. We're well average in mortality because we have such amazing physicians and nurses that take care of our patients and quality. And so we were seeing, especially early on, before we got some tools with the convalescent plasma and some of the other research studies that we were able to participate in, some of the deaths that occurred were unexpected degree of death or not being able to have family at the bedside. I think that was very stressful for the staff. They were the only resource. They were the only human person that could provide that person support as they were going through this very frightening illness, much of which was not understood, and we still have a lot to learn. And I think that was very hard on the staff, knowing that the family couldn't be there, whether to support that person or in their final hours of life. And they adapted quickly as well using the telehealth and FaceTime and things like that, but it still was very hard on them. So we provided that service hospital-based, so it was convenient for the staff, and they took great advantage of it. But there's also resources going forward through our employee assistance program, the intranet, and there's a 1-800 number. It's actually 1-800-448-4358, as well as you can go online. And in addition to the traditional services such as counseling and support and family counseling, they can help you navigate other things that you might need, care, legal services, financial counseling. Those are things that are available to our employees. And in addition, there's the Employee Relief Fund, where our employees have all gotten together and donated either money or their PL time to create a financial fund for people that might be struggling financially because perhaps another member in their household that helps provide financial support lost their job. I mean, we're 14,000 employees here in the Memorial Healthcare System with families, and inadvertently staff have people that lost jobs or had businesses and had to close those businesses. So we do have a resource if people are having financial hardships that they can tap into. Tim?
Add to that, as Tammy alluded to, we've been serving our own employees and their families for 20 years with discretion and following HIPAA guidelines and keeping it confidential, and we continue to do so. So our services are available to our employees and their families as much as they are to the population, the residents that we serve. As Tammy also alluded to, the Employee Assistance Fund is available for those who are challenged financially right now, mortgage, utilities, or anything else going on in their life that is creating a lot of stress. There's 211 Broward, and it's simply to dial 211, and that's the clearinghouse for all resources. And here in Broward County, compared to most, we are pretty resource rich. The key is trying to navigate and find those resources. And 211 Broward is that clearinghouse. And you simply, or there's a website, and I can get that to the folks to make sure that goes up, any resources that they send out, that you could plug in your zip code, and whatever the need is or whatever assistance, help, Whatever somebody's searching for, it'll come up closest to their residence for convenience. There's the Broward County Family Success Centers that are owned by Broward County, and they provide, again, rent and utility assistance, food assistance at times. We have a Feeding South Florida does a tremendous job with food insecurity in many cities and areas throughout South County. And the United Way of Broward also is another organization that any employee can utilize for any kind of financial assistance or other needs that may pop due to this event. And folks could call us, 954-276-0820, and we will help them navigate to help them get the needs that they have.
I think one thing that you're both are addressing so thoroughly, which I just feel the need to emphasize even more, that even though we're talking about behavioral health, there's a global aspect to what's happening in these past couple of months and will continue to happen, which is that it's not just psychiatric or psychological issues, it's not just emotional support, but it's that hierarchy of needs. If we don't have access to basic food, shelter, financial security, mental health, emotional well-being is out the window. And this is so incredible to hear these resources that you're directing our community for reality that, this may be unfolding for a long time, and we really need a bottom-up, all hands on deck, which is exactly what you've both been doing. And, I wasn't kidding when I said you're both the safety nets for us.
So true. There's the people who their lives from, impacted by the virus itself. And then there's just actually, even more than that here in South Florida, especially the secondary casualties, that are incurred, everybody's having to adapt to. And what you both are doing are really providing the care and assistance and support to prevent those secondary casualties amid this pandemic. So really thankful for all the. Anything else that you would like to say? Anything else that you would like our memorial community to know about with regard to what you're doing and how to access the resources that you have available? Please feel free.
Yeah, I would like to add that, one of the discussions that's going on in the mental health community, not just here locally in Broward County, but throughout the country. And Dr. Kumar alluded to it, as did you, Dr. Mehta, that we anticipate what's referred to as a mental health wave. So as the pandemic, the realities of the pandemic settle in, job loss, unemployment benefits perhaps run out, or people can't access those safety net resources, there is a concern that we may see a significant increase in the exacerbation of mental health problems, as well as people that perhaps never even imagined they would have a mental health problem. Perhaps somebody that's always had success, they've had a successful business, maybe a restaurant, and they've been doing very well. All the money you've invested in it, and you can't maintain your mortgage. You start to face what feels like homelessness. Your whole lifestyle changes. It causes conflicts with your family, and it takes out your sense of who you are, your identity. So it's not unusual to think that somebody like that would be in crisis. And we just want to emphasize for our memorial family, or anyone in your extended family, that we do have wonderful services in our outpatient behavioral health. And we have same-day access. People can walk in anytime, Monday through Friday from 8 p.m. And that is located on 29th Avenue. And the phone number, if somebody wants to actually call and make an appointment, is 954-276-3400. Reach out to me at ttucker@mhs.net, and I'm happy to talk to you or get you pointed in the right direction or linked up with one of our clinicians that can help in you or your family or anybody in your extended family that you might know that's struggling.
And I just want to add that I think, as the entire event now is 11 weeks going on 12 weeks, the shock and just, the unprecedented speed by which everything happened, and watching the news and the numbers, and just being fixated for the first few weeks And now we're seeing the grief start to set in. And as Tammy alluded to, some of that despondentness and hopelessness is starting to seep into families' lives right now. And you know, as she alluded to, we're going to see a mental health wave. We're also, hopefully we don't, but just on finances, we may see an eviction tsunami with a lot of evictions coming up. Working at high levels with Memorial Healthcare System, with Broward County, with the coordinating council, with the just to now start to figure out what to do with that situation if and when it does occur, before it happens. So we're trying to stay on the front end of that curve as well. And my number again here is 954-276-0820. And if we don't provide it, we will find, and we probably know, and we are probably a partner with someone who does provide what our employees need.
Great.
One other thing I'd like to just add that we haven't touched on, because I know we're getting ready to wrap up, is there is concern for our healthcare staff that are providing the direct services, and concerned, and a lot post-traumatic stress disorder. So I think it's very important for our doctors and nurses and even staff that are dedicated to the COVID units, or our PCAs, and anybody could be vulnerable to it. If they start to have difficulty sleeping, feeling depressed, can't get out of their mind, you know, maybe a patient that they made a connection to that passed away, or felt like they somehow didn't do enough to save that patient. You know, those feelings everybody's so busy just trying to step up and take care of the patients. It's not unusual, unfortunately, for an event like this, for there to be post-traumatic stress disorder. And I think it's very important for our staff to watch out for that. And if they're starting to feel those symptoms or experience those, comfortable reaching out for help.
Absolutely.
Thank you both so much. Your inspiring stories of healthcare innovation in motion really are incredible, and really delighted to be able to share what you do and all the wonderful work that you're doing, you know, to help people out there during this challenging time. So thank you both so much for your participation and dynamism. You know, we're looking forward to getting the word out about these resources that you provide. You know, incidentally, I am a sleep medicine subspecialist. So Tammy, thanks for the plug. Using sleep, and anybody who needs an integrative sleep consultation is more than welcome to seek us out as well. But thank you all for participating and for the great work that you do. Please do keep a lookout for additional resources and wellness panel dialogues that we're going to make available to our Memorial community in the future. Thank you all for taking the time to do this with us, and wish you all a great rest of the day and rest of the weekend.
Thank you.
Thank you both.